So I have been working in healthcare now for about 30 years. First in management roles, healthcare administration management roles, not in IT, and then in IT. I've been in IT for about 20 years now, and then the last 6 years as Chief Information Officer at Dayton Children's Hospital, which is in the Midwest in the U.S. Workday for our ERP. We're a Microsoft shop, 4,200 employees. So we're not a small organization, but retired from the U.S. military with 7 years in the Navy, doing not healthcare, doing on ships. Epic is in some ways far and ahead the leader, in some ways not. It sort of depends on the type of size of health bed. Epic is approximately 50% of all the hospitals. However, if you look at it in terms of the health system, it's about 30. In other words, it's larger health. It is not affordable or practical in the smallest of hospitals. So in rural areas, U.S. Hospitals tend on Meditech, on EHR, sort of in the middle there. So Epic, it's fair to say that Epic dominates large health systems down to about the size of effectiveness is the main thing. Many of these hospitals are not only on Meditech, they're on very old versions, on the verge of bankruptcy all the time. Sure. So first of all, we have to start out when we talk about AI, we have to be very clear what kind of AI are we talking about. Are we talking about generative AI? Are we talking about predictive algorithms, which depending on your definition of AI, the reason that distinction is important is because the predictive algorithms are not new. They've been around for a very long time, right? And when we started using machine learning to build better predictive algorithms, there's all sorts of applications of that. We're not done with that. It's not like we got done with that and then generative AI was invented, right? There's still more of that to do. Now they really mean generative AI. The reason that we have to separate those things is because they are completely different and handled differently. For the predictive algorithms, let's just leave it at that and call it a predictive algorithm, okay? I built a better algorithm than we had before, and now we want to use it somewhere in healthcare. Maybe on the clinical side, maybe on the business side, right? The accurate, I can say, it predicts something this much better than the last one, and it's going to cost this much to implement, and therefore it's smart to do or not smart, right? And you can have something that predicts something slightly better than the last thing, but if it's going to cost a lot of money to implement it, it's just not worth it. Okay, there's a lot of that out there. For generative AI, the challenge, of course, is with hallucinate generative AI. We have to be very, and you can't just start generative AI to diagnose a patient. There are powerful solutions that are coming, but the ones that are being put into place now tend to be the more back office or efficiency kind of things. The big one that everybody's talking about, and most health US are seriously looking at if they have not already purchased, is the ambient AI digital scribe. So Microsoft has a solution here, the DAX, Nuance DAX Copilot. Brid is another one. Those two are the ones that have the best Epic integration. There's other good ones out there, Nabla, Dookie. Doctor walks into the exam room, puts down their phone, says, "Hey, says the patient, AI is going to help me document. I can spend more time looking at you and talking to you instead of you seeing the back of my head while I'm typing in my computer." And this is going for the early adopters. We are about to adopt. We have not yet, but I'm paying a lot to adopt. And it's pretty overwhelming how popular it is with time. It saves them enough time every day that it really makes a difference to their practice and to their well-being. So we can hopefully avoid physician burnout. Any new technology, there's challenges to adoption. You have to speak to AI a little bit. You have to say, now I'm looking in the left ear. Now I'm looking in the right ear. There's the people in the room. In pediatrics, that's important because of course oftentimes the patient is not the person that the doctor is actually talking to. You're talking to mom and dad. So you introduces in the room or the AI. there's a lot of skepticism about. So what I said a minute ago, we're not letting the generative AI just diagnose patients, right? Because the malpractice is going to get sued when the AI is wrong, right? The American Medical Association came out not long ago and said, well, the AI is wrong. It's not the doctor's fault. It's the AI's fault. To have real soon. Now, what clinical leaders that are very smart about generative AI, what they would like to say is, let's not use the term artificial intelligence. Clear, it's helping doctors, not replacing doctors. And so, for example, you could have some AI developers are working on tools related to differential diagnosis, so that physician perhaps suggests, hey, I saw this lab test or something that might suggest this rare disease that you hadn't thought of in your differential diagnosis. Ask some more questions, ask the patient some more questions, but to rule out that augment provider would actually diagnose. That AI can do, generative AI can do very well, is just summarize lots of data that are a new patient, so an oncologist for cancer care, right? Typical patient when they're going to see a new patient, and it would be really nice to summarize that AI to help them be more efficient, because if AI can thoughtfully summarize things, that the doctor, if they had enough time, could read all of that. But AI can help summarize things. That's so some of the ethical dilemmas include bias, like just predictive algorithms, but this could also generate is more well-known examples. If you are using the healthcare data that's available, and the healthcare data is available towards people, and I'm now talking in the United States because we do our health insurance here very different than the rest. It's the people with insurance. Well, you have less data from the people that don't have insurance, which tend to underserve people, and there's some racial, bias there. And so sometimes you built the algorithm with not a representative of patients, so there's some biases in the data that way. You have to be very careful about that. Another thing that we have to think about is in terms of an ethical dilemma. So let's say that the algorithm is slightly biased in some way. We maybe even know it's slightly biased. Or another example with the generative AI, that maybe 1% of the time it hallucinates or something, right? It's not perfect, right? But and maybe we're talking about delivering care in an underserved area. What if that's the best at the time, because they weren't otherwise going to be able to learn about? If you withhold that, it's unethical. Hold that, yeah, right? So now this is where Epic comes in. This is very important. So Epic has had a long-time partner with of all the AI stuff. Epic is building into Epic all sorts of new generative AI features that an Epic customer can use if they want. Now, it's important to know that Epic is really a big development platform. So when you take your upgrade from Epic, they do quarterly upgrades. Some Epic customers upgrade every quarter. Some, like us, upgrade twice a year, take 2 upgrades twice a year. But when we get 100 new features, maybe we only turn on 50 of them because, I don't know, we're a children's hospital, them are not useful treating children or whatever it is. And so some of those new features now are powered by generative AI, but they may or may not be worth our time or worth our money to implement. It just depends what they are. So what a lot of people are doing is letting other people go first and see how that new AI feature that Epic offers is that truly delivering return on investment. Because there is also a growing trend as people are starting to publish on all of this that it's hard to get ROI on some of this. Some of it sounds great, and maybe does make the doc's day a little bit better, and from a wellness perspective is good, and that's worth something. Definitely, that's very important. But it may not be delivering hard ROI, right? And so if you have a health system that's almost out of business and has no margin, so what the government in the U.S. is working on is there's some regulations, mostly about transparency. Okay, which is a good idea. I mean, nobody's going to argue with transparency, right? So basically, if you're implementing AI, you have to be able to explain data that it's trained on and how it's being implemented, who built it. You have to be able to explain a lot of things and be transparent about it. Now, there's upsides and downsides to everything, right? So if, as a general concept, transparency is good, the only problem is if somebody truly is building some actual new intellectual property, and then they have to be completely transparent about what that is, that could hamper bringing new things to market. So we are always concerned about patient safety, and there's all sorts of patient, of course, it's de-identified, right? We've had all sorts of different flavors of patient data floating around forever. In the U.S., we have HIPAA is updating. We should certainly be updating those rules with AI in mind, right? Because HIPAA was written in 1996, really before EHRs were popular, right? So we do need to update some of that. But HIPAA, generally speaking, protect patients' data, and we have to think about something like if you completely strip the data of protected health information, of all the field protected health information, you then make the data not useful for research. Enough data to still be useful for research, but the name and birth date and all that is taken away, the things you can eat. That data is, yes, that's precisely the data that we need to train the AI, whether the predictive or the generative, right? So we have to be okay that our de-identified data, as a research database called the Cosmos, that last time I checked was up to 220 million patients. So the U.S., it's not only U.S., but it's continually rising, and it's very rich in clinical data, and it uses that limited data set. So you can't identify a patient in there, but it's enough data to be very, very useful. And so what Epic's now working on, it's been for a few years a great resource for research to go in and say, I have a research hypothesis. I want to study a rare disease, but there's not enough patients at my house. I got 5 patients in my house, but I can look in this database now, make a research hypothesis patient. Some of that intelligence comes back in a patient with this diagnosis, if you give on like that, in not real-time data, but very fresh data, as opposed to the old way of doing that was somebody would have a research hypothesis, they do research, they publish it. It takes years for all that research to happen, and then we're not very good at getting that new thing into practice. So if you can bring some of that into the clinical workflows that doctors have, that's very, very powerful. That can really make sure that we have the latest medical science at the fingertips. So one of the coolest things is that, but that's not even AI. That's statistics appropriately with lots of data. Definitely rocky road for all the reasons that we've just discussed. I don't think it's ChatGPT 5 comes out and it's better, smarter GPT. There's always that could be disruptive in. As Sam Altman, I heard Sam Altman saying recently, if your whole business model is built on some specialized something on top of ChatGPT 4 and ChatGPT 5 is going to just sort of wipe that out, then don't put all your money into that. Still lots of new things coming, and but for all the reasons we talked about, we have to be very, very careful and thoughtful and think about all the ethical things, think about all the ROI things, parent about things. So I think it's going to be continued slow progress, probably in the near term at least. Now, who can predict what's going to happen, 5-10 years from now? I'm not going to predict that. But in the next few years, I would say it's probably slower progress, with the exception of certain technologies like the ambient AI digital scribe. You think that what's going to happen there, that health systems that do not offer that providers, they might start their providers say, well, I'm going to do the other